Hello, everyone. Welcome, Dr. Mandell here with you. A very important topic, and we need to take this very seriously about the early signs and symptoms of a heart attack versus acid reflux. I'm going to try to go through this real quick with you. I understand there's a lot to say, but I'm going to be using different references. Please forgive me as I try to make sure, I want to make sure that I don't leave anything out. So let's go ahead and talk a little bit about the differences when we see the heart, versus we look at something like this in the stomach. Now, we talk about GERD. I want to talk about that acid reflux, commonly seen by the millions of people worldwide. Much has a lot to do with diet, fatty foods, eating too late, eating too much, lying down immediately after, being in a horizontal position, acid coming up, burning. It could be quite aggravating. I've had it myself, but diet is the way to beat this and combat this problem. Let's go ahead and talk a little bit about this. We're looking at a GERD here. Symptoms of GERD, we're looking at heartburn. We're looking at acid regurgitation. We get that sour, bitter taste in our throat or our mouth, especially after large meals, particularly if we eat late at night. Excessive salivation, a hot sensation, burning in our stomach area, and many times difficulty swallowing as we have what we call dysphagia. Now, if we take it one step further, we look here, just the pick of heartburn, but let's go ahead and we'll come back to that in just a second. I'd like to briefly explain a little bit about the acid reflux survival guide. What goes on in here? Well, you can see this. This is taken by Baylor College of Medicine. This is a great little chart, and I highly recommend you refer back to this chart. This is talking about habits, people who eat large meals, wines and chocolates and certain foods, lying down right after you eat. Obviously not the best thing. And obviously this will cause acid regurgitation. It can cause heartburn, bitter taste, as we talked about in the mouth, and an unexpected cough. Many people who get this acid reflux get this, this kind of like drip. They feel like they have to reflex. It makes them give them that feeling of a coughing. But let me just go over a few things here with you. We look at this burning sensation, and I just want you to understand this can mimic heart attacks because of the fact that we do have acid that can reflux back into the chest area, back into the throat area. And the reason why I'm talking about this first, so I will compare this to the heart, because our heart is the most important thing, because without our heart beating, we cannot survive. But here is the big kicker that I really wanted to go over here with you about GERD. It is a digestive issue. It's often a sharper pain that may be precipitated by eating a fatty or spicy meal, and it is affected by change in your position. So this condition will get worse when lying down or bending over. Now, stomach acid may come up in your esophagus, giving you that sour taste. Obviously, we tell people out there to lay on an incline where your mouth and your head is higher than your stomach. But the key thing here with GERD, this changes the intensity with lying down or bending over. Very important you understand that. That in the majority of all cases. Now, many times with this situation, let me come over here so I can you can see me talking. But many times with this condition, you can take acid blockers or actually Tums or calcium. And by taking that, you can actually feel diminishment of symptoms as you reduce the acid. So it's another symptom. But I don't want to promise people, because there are cases where you can take antacids, the symptoms go away, and you still may be experiencing a heart attack. So it's very important. Let's go on to a little bit about the heart. Let's talk a little bit about let's move over here. We look at the plaquing of the heart, and obviously when there's plaquing, high cholesterol, high triglycerides, when we have this sticky substance as well as inflammation, we can develop plaque in the arteries. And these arteries obviously is what allows blood to get to the different organs and tissues. So if the coronary arteries are not getting its proper supply, okay, obviously there becomes hypoxia or lack of oxygen, blockage of good oxygen trying to get to the heart cell, because the heart cells are muscle cells, and without oxygen getting somewhere, the heart will eventually die and necrose. If we look here, I just want you to understand a little bit about the location of pain that can happen during angina or heart attacks. Now, this can commonly go into the chest, into the throat, radiate to the arm, more commonly on the left side, but it can go into the right side. Substernal, because if it is underneath that rib cage, that is similar to what someone can feel with heartburn. Epigastric pain, you can see, can radiate again to the neck, jaw, and arms. Very common. Left arm we talked about in the interscapular area. Women and men may feel things a little differently, where one may have more dizziness and one may not. So I'm not going to specify what a man or a woman would have. I want to specify in general what to look out for. This is why we're here for. This will save lives, I promise you. So here we go. We have the heart in progress, trying to pump blood, and obviously this is a very common artery, the left anterior descending, the LAD coronary artery, blocked by a blood clot, obviously damaging the heart, not getting enough blood supply to the heart. These are some common signs of heart attacks, and this is very, very important. I really want everyone to look at this. This is so important. I'll try to add to this as we progress. I'm going to try to move through quick. Sweating, very, very common. If you notice that the temperature is not really, really hot and you're sweating and you're feeling dizzy and you're feeling maybe a little nausea, shortness of breath, that's a key. That's a key thing you want to pick out. If you're noticing you're getting shortness of breath, you're noticing that when you get up, you just don't feel right. You're noticing you're getting chest discomfort, feeling like a vice sticking in your chest. You may just feel really weak and tired. Now, we talked about the pain going down the arm, particularly in the jaw. That's another really important thing to understand, and that pain in your back or actually in the stomach. So understand that if you are having heartburn, look at the history. Look at your history. What did you just eat? Something fatty, something heavy? Did you just lay down? Did you notice that when you get up, the symptoms go away? That's a good clinical finding. If you notice when you lie down and the symptoms get worse, or they're coming up and you're getting this taste of this sour taste in your stomach, that's a clinical finding because you're going through a change. So heart attacks, you can have symptoms and they can't subside again. And you can have more symptoms and they can't subside. But the most important thing is catching it early. Always 911. If in doubt, check it out. I don't want to ever mislead anyone or tell anyone that you should be sitting around and waiting. I'm going to tell you a true story. This happened about 20 years ago. A fellow comes in my office. He's sweating. I took his blood pressure. You still can't tell by blood pressure, but he's sweating and he's dizzy. And I said, listen, I'm calling 911. He screamed at me, do not call 911. I wanted to call 911. He's telling me he's fine, this and that. Anyways, he went home and passed away. And that was one guilt feeling I was with to this day, because I should not have listened to him. So did I know 100% he was having a heart attack? No. But he insisted he walked out of the office, and if I called 911, he would have been gone anyways. But I will tell you, it's always good to be safe than to be sorry. Let me just go over a few things, some very important things pertaining to the jaw, the neck, that vice-like feeling in the chest area. Women are somewhat more likely than men to experience some other kinds of symptoms, particularly more shortness of breath, more nausea, more vomiting, and back or jaw pain. They say women experience this more than men, although I'm not going to go by the American Heart Association and say that's the way it always is, because it isn't. It may be more, but that may be that one person that's a man that's having it. So I'm trying to give you information as a general rule for everyone. I think that's extremely important. Let me just see over here. There's another thing I want to mention about angina. Angina is just contracture of the coronary artery. It's not necessarily as a result of a blockage or a clot. When it contracts, it may be stress, maybe walking too much, and it kind of shuts down. You lack oxygen, then you have to rest, and then you start to feel better. But usually at exertion, the pain gets worse again. But understand, when we're looking at heart attacks, we're looking at warning signs. They can happen hours, days, or actually weeks ahead. Early warning signs may be angina. It just may be this crushing and it goes away, crushing, go away. If you're feeling these symptoms, you don't want to wait, because many heart attacks can actually occur while you're sleeping, and actually it occurs in the morning hours, the real morning hours. You can check out my videos. We talked about drinking water, how important it is. But all in all, let me just review this pertaining to the heart, because this is the most important thing. We know stress can constrict arteries. Stress can block off oxygen, just like anything else. Stress kills. But if you notice you have an irregular pulse, or again, pain anywhere into the back, neck, jaw, arms, sweating, dizziness, nausea, difficulty breathing, that's a key one. You just feel like you're just not catching your breath, and if you are perspiring or feeling real dizzy, and I keep mentioning this over and over again. Why? Because I really, 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 I want to get this through you to get you to understand these symptoms, because it could be someone in your family, it could be a family member, it could be a loved one. You can spot it. If you spot it early, you can really save lives, not only yourself, but other people as well. So there you go, the difference between when we look at GERD or heartburn or acid reflux versus a heart attack. I really hope that this information helps you. I think it's extremely important information. I ask you to share it on your social media. I ask you to subscribe if you are new to the channel. Check out my videos, many great cutting edge nutrition and great self-help videos. Check me out on Facebook, Motivational Doc. Give me a couple likes wherever you like to. I appreciate that. But most important, I really want to send many blessings to you and your family. Keep up the great work. Stay proactive, and may God bless you, and we'll be with you real soon. Bye-bye now.